Many researchers inquire, can SmartPLS be used in their studies, in their field? So whether you are in business, psychology, or even in medical sciences, today I will explain exactly where SmartPLS fits in your study and why. So let's start. How SmartPLS can be used in medical and healthcare research, practical application explained. Also, in which areas of research, especially in medical and healthcare, can SmartPLS be applied effectively? In this study, we are going to discuss SmartPLS can be used in medical research and in which areas of SmartPLS can be used. Moreover, we are also going to shed the light in which fields, in which disciplines you can use SmartPLS for your studies, for your analysis, and while using SmartPLS, you can get the fair and better chance to publish your paper more effectively and efficiently and quickly. Smart PLS is not only for business, but it's transforming how medical researchers explore behavior, technology, and health outcomes. First of all, yes, now you are thinking about smart PLS in business research, smart PLS in medical research. I am wondering either smart PLS can effectively be used in medical research. Yes, smart PLS can be used in medical research too. Why, where, when, and how? These are the main question marks that we are going to explore. Previously, more frequently, social sciences and business students were using Smart PLS. And yes, one important fact related to medical sciences, medical studies is medical studies still lacking a number of publications and lacking in effectively in publications and researches. Though medical sciences is working very fastly and effectively, but it's also required to publish more literature. So, this is another debate. Right now, I am going to guide you how smart PLS can be used. Okay. Research fields that commonly use smart PLS. Now, social sciences and management. We are discussing about which areas of social sciences and management are actively there to use smart PLS. Yes, HR, human resource related studies, like related studies in related to trainings, development, hiring, outsourcing, and related all of the human resource matters, outcomes of that matters can use smart PLS for their studies, and it can go for the primary data. Marketing, yes, for marketing purpose, also for the purpose can get how the customer satisfaction can be achieved, what are the product reviews in customers' view, and how much the effectiveness of our product with the views of the customers who are using the product. If we are going to launch the new product, still we need to do the product survey, preliminary survey, before introducing the new product. This is also one of the expanded thing that we will discuss in another video. Leadership related studies, leadership studies widely using the smart PLS organizational behavior, organizational cultures, and multiple behaviors that are part of organizational culture, like cynicism and workplace effectiveness, incivility, moreover, organizational culture, organizational performance also comes after in behavioral studies. When we organizational performance is something it apart. Also, it can use the secondary data if we are going to measure the numbers. Educational studies, psychology, tourism. Yes, for these studies, mostly use the smart PLS, and also one of the most important, most of the times when we are going to use the primary data, we can consider to use the smart PLS. And the smart PLS, the praising of smart PLS, we can discuss in our other videos. Like there is an example I have created, exploring how leadership affects employee motivation and innovation. See, you can see exploring how leadership affects. So, in this statement, leadership affects employee motivation and innovation. There are three parts. So, between of the three parts, there is a study, and also we can say how organizational culture affect employees' creativity with knowledge sharing as mediator. These kind of titles, and there are many more. Once you are into the process, you can explore different titles related to your study, related to your interest, because once we are in our research and especially in our PhD process, always need to consider the topic that is we really love to explore. Otherwise, entire of the 3 years, 4 years, we are feeling ourselves in a trouble. We want to vomit our all of the theses whatsoever we are doing, and we'll have some kind of anxiety or depression because it's a journey. Medical and health sciences research, yes, the areas that effectively the elements that effectively use smart PLS and can be very active in using this. Healthcare behavior models. So for behavior purposes, yes, smart PLS is best. Patient satisfaction. Also, yes, in healthcare or medical sciences, you can say patient satisfaction, and in other industry, you can say customer satisfaction, client satisfaction, healthcare quality, the quality of your organization, institution. For the purpose to measure the healthcare quality, you also need to gather the customers' data, means to say the patient's data, means to say the stakeholders. Telemedicine adoption and technology acceptance in healthcare. Let's suppose there is an example also here, studying the technology acceptance model for doctors using healthcare system. So technology acceptance model is widely discussed, and still it's under discussion. This model is a very authentic and developed model. Many researchers are doing researches and exploring this model in different sectors, in healthcare, in other sectors. So this model exploring this model, or otherwise say measuring the customer satisfaction and service quality for the purpose to gain patient loyalty. Like this, you can also formulate your title, obviously according to your study. This will up to you. Here is only example. Now we can also use it business and finance studies, customer satisfaction, branding, ESG, corporate governance, innovation, management, financial literacy. Why Smart PLS is suitable for health research? Here is a question. The above three part we also have discussed previously, but still I'm going to discuss here. Work with small sample size. This Smart PLS software helps you to work with little or small sample size. Handles non-normal data. The data is normally distributed or non-normally distributed. Sometimes when you get the data, when you analyze and you find the distribution of the data is not normal. From different softwares, you may get the errors for abnormality of your data. But Smart PLS easily can manage this data, means abnormal data, non-normal data for the purpose of analysis, and supports complex model with mediator and moderators. Supports complex model with mediator and moderator. This is very important point that I just want to highlight. Why and how? The part when you are doing your study and you are at the point of conducting mediator and moderator analysis, it's quite difficult. Many researchers stuck here. Many researchers are good in literature writing, but once it comes to analyze the data and it comes to run the mediator analysis, run the moderator analysis, or make the calculations and find out either it is partial mediation, full mediation, or moderator is supportive or not, they stuck over here. And if they do have two mediators or two moderators in their model, or two dependent variables, it's also one of the very crucial and difficult part that perform the analysis from different software makes your work harder. But in Smart PLS, you can manage, although a need to have a good data collection, but still you can enhance your learning and you can work on your models, mediators, and moderators effectively. Helps test health behavior theories, like how it helps test behavior theories. See, health belief model, like we discussed, the technology acceptance model has been discussed in previous example, that measuring the technology acceptance, and also theory of planned behavior. Yes, related to this theory is also, this theory is widely used in medical researches, psychological researches, behavioral researches, and customer behavior researches, especially in employees and in consumer behavior researches. Wherever behavior comes, theory of planned behaviors um, can be useful if it is according to your scenario. Health belief model. Health belief model means to say what the health belief model indicates. It is sometimes we believe that we are healthy and our belief gives the energy to us. Means to say, health belief theory actually is one of the theory that works with your energies, works and explains that wishfulness, dedication, determination, and positive thinking about yourself or about others makes your things positive, means to say makes your health positive, means to say if someone is in chronic or major disease, they can work, or they can have good health, or they can be on a track of the recovering process while they believe their health. And so the next part, application of smart PLS models in medical and healthcare researches. So here you can see we do have different columns. The first column, I actually highlighted public health behavior, means to say medical research area. The broader actually area is, and I took one or two of the titles that give you the bigger picture. Rest, you can also do your researches, you can also do your things from your side and make it more effective. The other thing is research model or use cases. Previously, the discussed research model in these areas and the key variables of that areas, possible outcomes that were identified. So, public health behavior means how health literacy is perceived, risk influence, vaccination intention. So, see, here, let me go back to our previous slide where we were discussing health belief model. Also can be part, health belief model theory also can be part of it. Okay, or this study can be the extension of this model. Now, this was just one of the input from my side for your studies. You will also be the researcher, and you can better identify your area and identify the integrated theories for the best with your model. How health literacy and perceived risk influence vaccination intention. Health literacy independent. Perceived risk dependent. Vaccination intention is the dependent. Identify behavioral factors that improve vaccination campaigns. See, identify behavioral factors that improve vaccination campaigns. The other is patient satisfaction and service quality. Linking communication, trust, and loyalty in hospital services, the list of variables, and improve patient provider relationship and retention. Means improve patient provider relationship and intention. So clinical and educational training. Clinical education and training. Training quality, self-efficacy, performance of medical interns. Training quality, self-efficacy, clinical performance. The purpose, outcome क्या था? What was outcome? Enhance medical education quality and training readiness. So you can see there are the clues for your research: healthcare technology, telemedicine, psychological and behavioral health. Next is like pharmaceutical research, non-clinical health policy and governance, digital health adoption, community health promotion, nursing and caregiver research, health communication, and then health innovation and management. You can view these models and variables and outcomes one by one. These will be beneficial for you to understand in which way you are going, and the smart PLS will be the best fit for your model. One of the things that I also want to recommend the researchers, for the purpose to enhance your chances to publish good paper in means to say to publish your paper in good journals, like in top tier journals, then you also can use smart PLS along with SPSS in your medical research. Smart PLS and SPSS both can combine for the purpose to do your analysis and for the purpose of your better presentation. Also, smart PLS model creation is very easy, very presentable, very professional, and the model can give you the chance to interpret the model very effectively and easily. Um, and also, once you deal with the smart PLS, you can realize that how value addition software it is. Hmm. I'm not going to sell this software, but I just want to motivate you to use Smart PLS. That's how you can publish more papers and you can publish effectively. You can make your task easier. See, Smart PLS advantages: handles small to medium sample size. Yes, it can. Works with non-normal data. Great for predictive and exploratory model. Measures mediating and moderating relationships, easy visual modeling and reporting. So this side also there are yes, non-normal data can be skewed or non-parametric. The most important thing that the medical students can consider smart PLS. Why? Because in medical studies, the sample size most of the times is very small or limited number of the respondents they can get. So that's why it is fair chance to have a good result and find your analysis and find a software that can process your results with a small sample size and with your non-parametric skewed data that is not normal. Finally, I would also encourage you to use smart PLS models and models when your model is complex, predictive, or exploratory, and then call to action. If you are thinking that you need more understanding on any of the topic, then just write me in a comment and I will make a video for you for your understanding that will help you. Thank you so much. Jazakallah.